Good morning, good afternoon, dear colleagues. I hope technically all is good. My name is Oliver Schmoll. I'm managing the Water and Climate Program at the WHO European Centre for Environment and Health. And I have the great pleasure to welcome you to the second edition of this Transatlantic Dialogues, this time on health sector governance and climate action. Please be aware that this session is translated into 3 languages, English, Spanish, and Russian. And you should find at the bottom of your screen an interpretation button. And if you click on this, you can select the language that you prefer to listen to, English, Spanish, or Russian. I also would like to inform you that this session is being recorded for rapporteuring purposes. And I would like to highlight that there is a Q&A, question and answer box during the session open for any observations or questions that you would like to share with the audience of this webinar. It is now my great pleasure to invite Dr. Hans-Henry P. Kluge, the WHO Regional Director for Europe, to open this session. Dear Hans, we are really glad to have you with us. Over to you.
Thank you. Do you hear me well, Oliver?
Yes.
Are you hearing me fine?
Yes, Hans.
Thank you.
Yes, we hear you fine and see you very well, Hans.
Thank you. Thank you so much. Dear Excellencies, my brother, Dr. Jarbas, dear friends, welcome very much to this second in a series of transatlantic dialogues. We are well aware that climate change is threatening global public health at a breakneck pace. Yet the fact is, many of our health systems remain poorly equipped to handle the challenge. The Lancet's Countdowns 2024 Europe report laid out how national adaptation plans are too often poorly implemented. That the health sector is not coordinating enough or being integrated enough with other sectors like agriculture, water, and urban planning. Just a couple of weeks ago, I was reading about the effectiveness of adaptation efforts in nature medicine. Modeling showed that without adaptation, the number of heat-related deaths in Europe would have been 80% higher than observed, particularly among the elderly. Climate adaptation efforts across all sectors do save lives. So lack of science or lack of understanding is not the problem. What we do need urgently are effective governance frameworks to implement and coordinate an all-of-society response. We need to work together better to take stronger, more effective, health-oriented climate action. This year, the World Health Assembly adopted a new resolution and WHO's new 14th General Program of Work to mainstream climate action across the public health agenda. And last year, countries of the WHO European region adopted the Budapest Declaration on Environment and Health, prioritizing urgent, wide-ranging action on health challenges related to climate change, environmental pollution, and biodiversity loss. One outcome has been the Partnership for Health Sector Climate Action, which has already created a community of practice for countries to learn from each other. I would like to thank my colleague and good friend, Dr. Ute Teichert from Germany, for triggering today's debate with her curiosity. Dankeschön. Dr. Ute has recognized the need to rethink climate and health governance and to create a space for exchange and mutual learning. I particularly express my gratitude to Austria and our host, the Austrian National Public Health Institute, and my good friend, Dr. Herwig Osterman from Gesundheit Österreich, for making today's discussions happening. Dankeschön. I look forward to learning from you on how we can do better. And now I hand over to my partner, my brother in this transatlantic dialogues, from who I continue to learn a lot, Dr. Jarbas Barbosa, the director of the Pan-American Health Organization and WHO Regional Office for the Americas. Thank you, gracias, and over to you, Dr. Jarbas.
Thank you. Thank you, my dear friend and colleague, Dr. Klug, Director of Euro, WHO, Dr. Small, esteemed member states, partners, and colleagues. Welcome. It's a privilege to join you today for the second transatlantic dialogue on health sector governance for climate action. These dialogues are a joint initiative between the WHO Regional Office for Europe, the Pan American Health Organization, and the U.S. Department of Health and Human Services, have become a vital platform for fostering collaboration and shared learnings across the Atlantic. Today's dialogue is particularly significant as it addresses the urgent need for strengthening health sector governance in the face of climate change. With the increasing political momentum behind climate action, propelled by compelling health evidence, our discussions today will take stock of the diverse governance mechanisms and institutional arrangements that the member states have adopted to integrate the climate considerations into health governance. At PAHO, we recognize that effective governance is critical to advancing climate action with the health sector, and in recent years, our member states have made significant strides in this area. In the region of the Americas, 32 out of the 35 countries included health representatives in national interministerial committees on climate change. This inclusion is a testament to the growing recognition of health as a central pillar in climate resilience. Moreover, PAHO has been actively supporting countries in integrating health into their national adaptation plans and nationally determined contributions. This integration is not just about the policy alignment. It's about ensuring that health is a priority in climate action strategies at the highest levels of government. The countries of the Americas in 3 weeks at the PAHO's 61st Directing Council will discuss the policy on strengthening equity-oriented health sector action on climate change and health. One of its core aspects of this policy is to raise the profile of health in climate change discussions. It emphasizes the importance of fostering community participation to ensure that all voices are heard, particularly those from populations in situations of vulnerability. Equity remains at the heart of our efforts, and we are committed to ensuring that the health sector plays a leading role in addressing the disproportionate impacts of climate changes on different communities. In the Americas, we have also conducted high-level workshops to raise political awareness about the critical intersection of health and climate change. These workshops have been instrumental in building the political will necessary to drive forward the national and regional climate action. Today's dialogue, and I want to thank you again, my dear colleague and brother, Dr. Klug, and also the U.S. Department of Health and Human Services for this very important initiative. This dialogue today offers an invaluable opportunity for countries to share their experiences, learn from one another, and explore innovative solutions to common challenges. By working together, we can develop governance frameworks that are not only effective, but also inclusive, ensuring that our health systems are resilient and responsive to the challenges posed by climate change. Thank you, and over to you again.
Thank you so much, Dr. Kluge and Dr. Barbosa, for your inspiring opening remarks. And I think I'm speaking on behalf of the entire community who is connected here today to thank you also for this initiative of the transatlantic dialogues for kicking the ball of a joint learning space and networking across the Atlantic on both sides, the Americas, as well as the European region. I think this is a very fruitful developing initiative, and we are very happy to see the second edition of this dialogue here and today. Today we are going to focus on governance and institutional arrangements that support health-oriented climate action. I think this is, as both regional directors and regional director have already mentioned, we see all over the place, globally and regionally, increasing significant momentum when it comes to global and regional climate and health commitments being made. It was only earlier this year when we saw the World Health Assembly adopting a resolution on climate change and health with a series of commitments being taken by member states, but also by WHO. We have seen last year COP28 for the first time with 50 and more health ministers attending to adopt a global COP28 climate and health resolution. And we have several regional initiatives ongoing on both sides of the Atlantic. As one of the earlier speakers here today in Vienna said, the key question, however, is on how we bring commitments on paper into action. And in order to bring commitments and aspirations into fruition, we will need to put a lens on, and we need to talk about appropriate governance frameworks, fit-for-purpose institutional arrangements. We will need to speak about a well-equipped workforce supporting the implementation of this agenda, but also issues around resources. So this dialogue is one of the opportunities to inform each other on national approaches being taken and to learn from each other and to establish networks within each region, but also across the region in order to discuss openly and frankly of what works to foster implementation, but also possibly to reflect on what doesn't work for the time being and what solutions are needed to come in the future. This is a little more conceptual, this discussion that we are going to have is a little bit more conceptual and little less technical than a typical WHO meeting, yet still a very essential step in effective policy making. To this end, we have invited today 6 speakers or countries, 3 from each side of the Atlantic, from the European side, Austria, Germany, and the United Kingdom, as well as from the side of the Americans, Antigua and Barbuda, Brazil, and the United States of America, as well as a range of partners to share their thoughts and to share their experiences when it comes to governance and institutional arrangements. Finally, before I hand over for the next session, I would like to say that I'm actually speaking from within a room in Vienna, in Austria, where I can see in front of my eyes about 30 participants from several member states, from particularly ministries of health and other health institutions from member states across the European region, as well as partners. And we will take the outcomes of today's webinar of the Transatlantic Dialogue and use the inputs for a full day of further discussion that we are going to have here tomorrow in person to further unpack and to discuss the elements that rank around governance, effective governance and institutional arrangements. With that, I'm happy to hand over to my dear friend Daniel Bus from PAHO, from the Pan-American Health Organization. I hope, Daniel, that you are ready to go and to kick off the next session with the country examples.
Thank you, Oliver. Thank you, colleagues. I hope you can hear me well. Thank you very much for organizing this session and this dialogue. It's a pleasure to be together, PAHO, WHO Euro, and HHS in this important dialogue. Thank you for the directors of both PAHO and Euro for their opening remarks. So now, as Oliver indicated, the idea is that we can hear about some national experiences and country case studies on climate change, health, and the governance structure between these important topics, and making sure that health is participating in the decision-making processes at national level and taking strong messages from health to global and regional and global discussions. So I will now going to hear from 6 countries, 3 from each region, Europe and Americas. And I would like to invite to start from Austria, Dr. Judith Belgracie. I think she's right next to you, Oliver. She's the head of Health and Promotion and Disease Prevention on the Federal Ministry of Social Affairs, Health Care and Consumer Protection from Austria. So, Dr. Judith, please, you have the floor.
Thank you very much. It is a great pleasure for me to welcome you in Vienna. I really hope you'll enjoy your stay, at least those of you who are in Vienna at the moment. For all the others, I hope you enjoy the meeting. And I'm really delighted that today I'll be able to share our experiences regarding one of the most challenging public health topics of our time with you. It's easy to guess, I'm talking about the climate crisis and its effects on people's health as well on the healthcare system. I will introduce you now to a new competence center that we founded 2 years ago and that I have to say we are most proud of, the so-called Competence Center for Climate and Health, which is located within our National Public Health Institute and funded by the Ministry of Health. What might also be interesting for you to know is that the Competence Center isn't an entity standing isolated on its own, but it's part of the Ministry of Health's current main health promotion initiative, and this initiative is called the Agenda Health Promotion. So let me now tell you the Competence Center story. Can I have the next slide, please? Great. Yeah, perfect. Unfortunately, health-promoting funds in Austria have a tendency of being rather tight, especially if you compare them to the funds that we're spending for the healthcare system. But however, a few years ago, we were facing a window of opportunity in the area of health promotion, and when I was preparing it, I was wondering, what are you doing with a window of opportunity? Are you jumping through it? Are you opening it? I don't know. Actually, we just took advantage of this window of opportunity. And what did it look like? What was the opportunity? First of all, during the pandemic, we noticed an increased awareness of the importance of public health. And not only was there higher awareness, but we had some smart people, I'd like to say, who allocated 8 million euros per year for the Ministry of Health's disposal for health promotion activities. And for us, this really was a game changer, because up to that moment, the health promotion budget was rather low, and all of a sudden, we had a chance to really make a change. And we established 3 competence centers, and one of them is the Competence Center of Climate and Health. Another advantage that we had at that time was that we didn't have to start from scratch, because a long time before the pandemic already, we started a big intersectoral process, the so-called Health Targets Progress, and there we developed 10 health targets for Austria that are closely linked to the Sustainable Development Goals and that follow a health and all policy approach. And we worked closely with other sectors, and we still have intersectoral meetings taking place in regular intervals where we discuss how to reach our targets and current situations. So we already had a really good tradition of intersectoral cooperation in place when we founded the Competence Center, and this was really helpful because a good cooperation, especially between the Ministry of Health and the Climate Ministry, is essential for our activities now. And last but not least, it also helped our matter a lot that in 2020 the Green Party came into government for the first time in Austria, and now both the Health Ministry and the Climate Ministry are ruled by the Green Party, and naturally they brought climate into the focus of governmental policies. So as you can imagine, they also supported the founding of the Competence Center, and they made sure that we had sufficient funds for our matters. So I can just say no better time than this to establish a competence center on climate and health. And let me now give you a few details about the competence center itself. As I said, it was founded in 2022. And I'm going to read to you the core tasks. It brings together interdisciplinary expertise from science, policy and practice at the interface of climate change mitigation, climate change adaptation, health promotion and healthcare. And on behalf of the Ministry of Health, which actually has a longer name, it develops sustainable and evidence-based strategies and innovative projects for the health system, scientific knowledge, and it develops health policy frameworks. And in 2024, this competence center was divided into two departments, the Department for Resilience and One Health and the Department for Climate Neutrality and Sustainable Transformation. Next slide, please. And there are a few more facts about the Competence Center. It consists of an interdisciplinary team with experts from various fields of public health, psychology, health economics. You can read it there. I'm not going to name them all. There are quite a lot, and between 22 and today, the team has doubled, and right now there are 16 people working there. The work builds on the public health action cycle, and the Competence Center is funded by the Ministry of Health, and initially there was no funding from the Ministry of Climate. However, as you'll hear later in the presentation, there now is a substantial funding regarding our biggest project, the consulting project for climate-friendly healthcare facilities by the Ministry of Climate, and this is great. So on the last point, they're also participating in national and international research projects and by doing so, they're acquiring third-party funding. So let's go more into the details now, and I'm starting with the Department for Climate Neutrality and Sustainable Transformation. The department's main goal is to create a low-carbon and sustainable healthcare system. So over the last 2 years, the department developed new strategies and innovative projects to support the healthcare system as well as healthcare facilities to become both sustainable and to reduce their carbon footprint. And here on the slide, you see the names of the international best practice projects, and I'm going to talk more about two of them. The first one is the so-called net zero healthcare system strategy. And this strategy was developed both by stakeholders and experts and presented 2 months ago to the public by our Ministry of Health, together with the Minister of Climate and some well-known experts. This strategy is designed to be the foundation for the healthcare system and the healthcare services to become climate neutral. First, you always need a strategy. And in the strategy, you find an analysis and definition of the framework condition of the fields of action and options for action for the structuring, anchoring of climate protection. Actually, I could tell you more about this, but I'm a little afraid about the time, so let's just leave it with, we have a strategy and this is it. So if you want to have a closer look, you can have it later on. And yeah, we have this strategy as a foundation, and then there are projects to implement it. And one of our, I'd like to say, most exciting projects is the consulting project for climate-friendly healthcare facilities. And in this project, the major goal is to support the healthcare facilities to become green and sustainable and to take full advantage of the benefits, which in our opinion are a lot. So what are we doing? We're sending experts to the healthcare facilities, and they provide the facilities with all the necessary expertise and guidance, and they cover all action areas that enable them to become climate neutral. And these actions areas include quite a lot: buildings, mobility, energy, food system, green spaces, sustainable procurement, plus resource and waste management. So you see there's a lot to do. And what we're also providing is expertise from just one single source. We believe that the path to change has to be as easy as possible, and having just one source really helps a lot. What about the participants? I guess you're wondering now. The project started 2 years ago, and in the meantime, 427 healthcare facilities have become part of the project. And out of these 427, 110 are hospitals. And this is also great because, as you can imagine, hospitals are big institutions, and the bigger, the higher the impact. And then, this is not on the slide, but let me draw special attention to it. The other big success of this project is that that the Climate Ministry has allocated a total of 400 million euros for investments in energy-efficient measures in hospitals, in retirement homes, in nursing facilities and rescue organizations, and this is linked to our project. So you have to participate in the project to get the funds, and this is great. And we're really proud of that and happy about it, because funding plays such an important role for the realization, and we couldn't have done this without the Ministry of Climate. And yeah, I have to say they gave the project a huge boost, and this shows, for me, this shows just how fruitful intersectoral cooperation is. And let's now continue with the second department, also very interesting for climate resilience and One Health. And as you can see on this slide, we're using the famous WHO framework there. And this framework indicates that climate resilience of health system needs to be built at all levels, from governance to the health workforce to health information systems. So the department runs several projects and cooperations to strengthen climate resilience of the health system in Austria, and there are 3 central pillars which we are working on. The first pillar, we're developing a national health adaptation plan. Here again, first the strategy, the plan, and then as a foundation, and then the implementation. Second pillar is building a climate smart health workforce. Okay, I need to hurry up, I see. Second pillar, developing a climate smart work health force. And we've just recently published a great handbook that can be used to design classes for training and education for health professionals. And in a few weeks, there will be the first Train the Trainer course for people that are teaching health professionals taking place. And we're really looking forward to that as well. And there's also something on climate smart population and regions going on, and some more activities that now I will skip just to continue with our lessons learned. Next slide, please. So, look for the right window of opportunity. It really helps a lot to have one, but if you don't, please try anyway, because climate mitigation and climate change adaptations, they are no longer just an option. In my opinion, right now they already are an obligation. And when it comes to climate and health, you have to create ownership across sectors and across governance levels. Of course, this might take some time and some effort, but it really is worth it, as I think I've demonstrated to you before. We also recommend that you try to diversify your funding sources, because we believe that funding from multiple sources leads to more ownership in other sectors and on other government levels. And our experience has shown that health in all policies has benefits for all involved parties and really pays off. Last but not least, highlight the advantages and the benefits of climate mitigation and climate adaptation for health, and talk about it loud and proud. And these benefits, advantages are achieving a significant cost reduction for healthcare facilities and society in generally, offering a climate-friendly and health-promoting environment for both patients and employees, and improving healthcare facilities' image and increasing employer attractiveness. So, believe me, with all these advantages and benefits, it will be very hard to say no. Thank you very much for your attention.
Thank you very much, Dr. Delle Grazie, for your amazing presentation. I'm pretty much interested in a lot of things that you said here and the other side of the Atlantic as well. So if you can send us a few copies of these documents, we would love to circulate with our member states as well. And taking notes of the amazing work with healthcare facilities that you guys are doing in Austria, which pretty much interests us as well to learn a little bit more. Now I have the pleasure to invite Dr. John Balbas, who is the Director of the Office of Climate Change and Health Equity in the Department of Health and Human Services from the United States of America. John, it's a pleasure to have you here, and you have the floor. Thank you very much for sharing some notes on the national efforts in the U.S.
Thank you so much, Daniel, and it's a real pleasure to be here. Thank you, Oliver, and Daniel, for setting this up, and our directors, Kluge and Barbosa, for their introductions and their oversight. Again, my name is John Balbas. I'm the Deputy Assistant Secretary for Climate Change and Health Equity in the United States Department of Health and Human Services, and direct our Office of Climate Change and Health Equity. And I'm happy to share a really complex country and system of governance, and try to open up the hood for everybody to share how we are trying to make this happen. I just want to start by just defining what we mean by climate and health governance. I haven't seen a definition, but I want to especially distinguish between the initiation of action, the coordination of action, and the control and direction of action, and focus on that control and direction, and to the extent to which we have control at a national government level of actions in climate change and health, either within the federal government or, as I'll illustrate, at the state and local level, where a lot of the governance and control of health is in the United States, or in the private sector. So let me give you some bottom lines up front. The federal government acts if it gets the authority and the funding from the US Congress. So much of the power in control and direction actually originates in the US Congress. And so within those authorities given to the federal agencies, there's often limited ability to add in new things like climate change and health. For example, there are questions about whether our Medicare and Medicaid program has the authority to start to require reporting of greenhouse gases. Those authorities originate in Congress, and Congress has a lot of control. The federal government gets to interpret what comes from Congress, and then, of course, our Supreme Court makes the final decisions. And all of those institutions have their various challenges and changes that have happened over the last decade. So the Department of Health and Human Services, our health ministry, is actually an amalgam, a joining together of 12 different operating divisions that each have major programs. So it's almost like, in itself, a confederation of states and organizations. The Secretary's Office of Health and Human Services, and where I work, the Office of the Assistant Secretary for Health, provide the main mechanisms for coordination and, to a lesser degree, governance among all these operating divisions. And these include things like the CDC, or the Food and Drug Administration, or the Center for Medicare and Medicaid Services. They all operate with a lot of their own autonomy. The federal government as a whole has a very limited role in health governance in the US. Much of the decision-making, much of the rulemaking for health governance occurs at the state, local, territorial, and tribal levels. And the US government provides guidance, technical resources, and funding. But a lot of the states have control over the kind of programs they have, how surveillance is done, how money is spent. It's not just the Department of Health and Human Services. Many federal agencies have a role in climate and health governance, including our Environmental Protection Agency, our Department of Agriculture, which funds rural health systems, our atmospheric, NOAA, the Oceanographic Atmospheric Administration that has funding for resilience of communities, Housing Urban Development, obviously, our Emergency Management Agency, FEMA, our Lands Management Agency, the Department of the Interior, and our Department of Energy. So there are a lot of cats to herd. There are a lot of different of agencies in different sectors that all are part of the climate health governance in the United States. And so to get things done, we have to work in partnership. And many coordination structures exist in the federal government, and many more have been added over the past 3 years of the Biden administration, the Biden-Harris administration. Our Office of Climate Change and Health Equity, just created 3 years ago, is playing a major role in both the coordination and the catalysis and the encouragement and enabling of action. The capacity building is something that our office is doing. But control is limited, I'll say. We have a lot of ambition and limited authority and limited governance. But our goal is also not to create an office that tells everybody what to do, but it's to foster the integration of climate change thinking, climate change knowledge, and especially climate change action into the mission space of all parts of the Department of Health and Human Services. So that's the summary. I'm just going to unpack a little bit to say, just an illustration of how fragmented the health system is in the United States. If you look at who pays for healthcare in the United States, it's about 30% private health insurance, most of it done through employers. About 40% comes from the federal government through Medicare and Medicaid, and the rest is out of pocket or other kinds of philanthropy. So the payment is very split. Out of the 6,000 hospitals in the United States, about 3,000 of them are not-for-profit community hospitals. About roughly 1,000 are state and local, and there's a little over 200 federal hospitals. So again, a lot of the control of the healthcare system is either in the private sector or at the state level, very little control at the federal level. The state, local, territorial, and tribal governments have a broad range of legal instruments related to the oversight and provision of healthcare services. At that level, the state and local, territorial, they determine licensing requirements, for example, which are very important. They determine a lot of the education and the competencies that healthcare practitioners have to have. The surveillance system originates at the state and local level. It's not a federal surveillance system. The federal gets reports from the state and locals. So all of these things make that governance complicated. There are numerous policy coordination mechanisms for climate and health governance in the United States. I'm going to split them. There are many that are just domestically focused, and that I think is our focus, but I'll talk about our international coordination mechanisms as well. The most long-standing is our Global Change Research Program. This has been mandated by Congress in 1990. Since 2010, so the last 14 years, it has had a climate change and human health working group, which has been the primary locus for coordination of all things climate change and health across the federal government until just recently, because it was the only working group where our climate change and health community could come together. And it's been responsible for the vulnerability assessments, for the literature reviews, our national climate assessment, for our climate and health assessment of 2016, Many of much of the activities have been controlled there. This administration, President Biden created a climate task force, so a cabinet level task force, which was a major governing mechanism for climate policy. And we do not have a singular adaptation task force in the United States, which I think we will get there. Right now, we have multiple resilience working groups, including a heat working group. There's a wildfire working group, a flooding working group. The heat working group has done a lot of work to coordinate the activities around climate and health and extreme heat in close partnership and actually merging with our National Integrated Heat Health Information System, which is itself an interagency working group with 29 different federal agencies, which just released in the last month a new national heat strategy. We have multiple interagency working groups around climate adaptation on an international scale. Most of these are convened by the State Department. The State Department also draws all the agencies together to plan for the UNFCCC COP meetings. And then we have multiple ways of coordinating and governing things that are not quite climate change and health and not the health sector, but are closely related, mostly related to disaster risk mitigation. Every state has to have every locality has to have a hazard mitigation plan to get disaster funding in the face of a disaster. So there's a mitigation federal leadership group. There are there's a thriving communities work group, all of which are working on human services and resilience of communities, not climate specific, but they are coordinating a lot of the funding that is funding climate resilience at the community level. Just to talk about our office a little bit more, again, we were created by executive order by President Biden, charged with protecting the nation's vulnerable populations. We have been charged with both setting strategy for the department work, but also mobilizing, not just setting strategy, but building the capacity of HHS and coordination really across all the federal government. Of course, as I said, much of the U.S. health system is private, is not controlled by the federal government. And so to actually make progress on the health sector in the United States, our office is really focused on mobilizing and supporting the private health sector. And a major initiative of this has been our health sector climate pledge that we did in partnership with the White House. But it's a voluntary effort, right? So in terms of governance, our governance is, we are working on, the direction and the control that can be made available through the authorities given to the federal agencies. But in the meantime, we have a major voluntary commitment effort, inviting health sector stakeholders to match the administration's commitment to resilience and decarbonization, net zero by 2050, 50% drop by 2030. We now have about over 900 of the roughly 3,000 private hospitals and the for-profits as well, along with a number of major pharmaceutical companies. And that is a way in which we are coordinating, providing guidance, helping connect the private sector to the resources available, for example, through the Inflation Reduction Act. That is a major part of our work. But again, it doesn't have that governance, that tight governance mechanism. In terms of a national climate adaptation plan for health, at this point, the United States does not have even a comprehensive climate adaptation plan that's not health specific. Under the Biden administration, each agency has created its own climate adaptation plan, mostly focused on understanding the vulnerability of that agency and its assets and taking actions to enhance the resilience of the agency itself. Our Health and Human Services Climate Adaptation Plan, created 2021, has bridged both agency issues and the role of HHS in ensuring health of everybody in the United States. And our office since then has convened a work group of all of the divisions of the Department of Health and Human Services. And last December at COP, we released a comprehensive all of HHS strategy that describes the actions the HHS divisions are taking to decarbonize the health sector and to enhance the health resilience of people in the United States. And this is everything from, our human services side, offsetting home energy expenses, to waivers issued by Medicare and Medicaid for sustainable microgrids, to the technical assistance programs that provide technical assistance for quality that are increasingly helping hospitals and nursing homes to become more climate resilient. I'm almost done. Two last things. One other governance mechanism relates to the federal health systems. So the federal government provides about 20% of the healthcare in the United States through the military system, the Defense Health Agency, the Veterans Health Administration, and the Indian Health Service. Under another executive order, all federal agencies, including those health systems, have to abide by the Biden administration goals of net zero by 2050. And our office is convening all of those federal health systems into a learning network to, again, the governance comes from the executive order. We're providing the capacity building and the technical assistance. And then lastly, with so much of the health sector's carbon footprint associated with healthcare supply chains, the issue of healthcare procurement standards for reporting and reducing greenhouse gas emissions is very prominent. There is a proposed rule in the US Federal Acquisitions Regulation, we call it the FAR, which governs the massive contracting of the US government. And this proposed rule would set requirements for major contractors with the US government, including those supplying the federal health systems. That rule is still trickling through the process, but as we wait for it, our office has reached out to connect to and leverage efforts underway in other countries, especially with NHS England, to document overlaps in procurement requirements. NHS England has laid theirs out very clearly, and we're working in a multilateral way to provide the global industry with a guidance to what are going to be the commonalities among those procurement requirements and what are the differences so that companies can better accelerate decarbonization of the supply chain. So in summary, many projects, many activities have sprung up in the last 3 years, some of it related to our office, but really organically throughout the federal government, spurred by executive orders, spurred by landmark legislation from Congress that was not health specific, but is available to the health sector through the Inflation Reduction Act. And then with our decentralized, federalized system, there's a lot going on at the state, local, territorial, and tribal level, many structures for coordination, and limited national scale governance. So thank you for all that. I hope that's interesting, and I look forward to the rest of the presentations.
Thank you very much, John. Very interesting indeed. And also it calls the attention of the importance of always engaging with the private sector as well. I think that the US has a very unique structure, and it's very important for us to hear about that. And I think that you gave a good segue to the next presenter, who is from the NHS. So Dr. Hitel Patel is the head of strategy, Greener NHS, a National Health Service from United Kingdom, Great Britain, and Northern Ireland. I hope you can, you're there in person. So thank you very much. You have the floor. Thank you.
Pan-American Health Organization and the US Health and Human Services Department. As they say, I'm Hitel Patel. I am from the NHS in England. I am the head of strategy as part of our Greener NHS team, which kind of oversees the climate change work within the NHS in England. It is quite complicated though, so I'm speaking today kind of as part of the UK delegation, but the United Kingdom context is very complicated. We talk about the National Health Service or the NHS kind of singularly, but in actual fact there are 4 kind of national health services within the United Kingdom across the 4 devolved nations, led and kind of overseen by Department of Health and Social Care, a colleague in the room, Anna, who works for them, and then NHS England, who I work for and which the Green NHS is part of, oversees the NHS, leads the NHS in England kind of with a responsibility over budgets, over policy, over strategy, and kind of delivery on the ground. Having said that, it still is quite complicated. The NHS in England is made up of 7 regions incorporating 42 integrated care systems, which are kind of local systems that cover around 1 million people and kind of oversee health, social care, and the kind of broader public health within that region. And they bring together local kind of partners, including our kind of local authorities, our councils, our transport districts, transport partners, and kind of bring them together at a local level. And then below that, we have 212 kind of hospital trusts, which kind of oversee kind of the hospitals and the acutes, the primary care, mental health, and they are vary in size. There are some that employ up to kind of 20 to 30,000 people, and then there are others that employ kind of 1,000, 2,000 people, and only have kind of 1 emergency department or have no emergency departments, whereas others might have 3 or 4 in the kind of big and major cities. And within all of that, we work kind of within that framework. The reason I'm talking about this is, I think, to kind of help set some of the context. The NHS in England, or the NHS in the UK, is a public healthcare system. It's free at the point of use for kind of citizens of the United Kingdom, and we employ, and I think we're the largest employer in Europe, 1.4 million staff just in our English healthcare system. We're a gigantic organisation, but luckily, the majority of healthcare in England and in the UK is public healthcare. The NHS in England, I guess, contributes around 5% of UK emissions, around 40% of public sector emissions. We have a huge kind of task and ask that we have to kind of deliver against. And kind of within that, there is a whole bunch of things that we are trying to do. So over the last couple of years, we have invested £1 billion in kind of energy efficiency and kind of heat decarbonisation within our hospitals. We're kind of barely scratching the surface. There's a lot more that we need to do over the coming years. When it comes to our fleet, we've introduced kind of zero-emission electric double-crewed ambulances that are kind of operating. There's only a couple of them in the country, but we're trying and kind of piloting and seeing what we can learn as we try and roll out what we do. I guess it's really important to say why we are taking it so seriously, and I'll kind of come on to that in a second, in England and I guess the UK too. But just in England in 2022, there was over nearly 3,000 deaths related to the heat waves in the summer of 2022, and we have 38,000 deaths in the UK that are attributable to air pollution, and we also know the cost of climate change is growing. The UK Health Security Agency estimates that by 2050 it will cost the English health service only nearly £15 billion per year from the kind of mitigations and issues related to climate change. Where and how do I come here? Why am I here? Why does the Green NHS exist? I think it's worth kind of going back to 2008, where the Sustainable Development Unit was set up. This unit was set up after the UK government kind of set out its Climate Change Act, which kind of committed itself to 80% reduction in carbon emissions by 2050. And as part of that, the Sustainable Development Unit existed. It was one of the first, I think, organisations that existed within a kind of government body that kind of looked at the carbon footprint, look at the emissions, look at the kind of environmental impact of the health systems, and it kind of operated as a think tank for the NHS and also the Ministry of Health. Things changed pretty significantly kind of in 2019 and 2020. In 2019, the UK government kind of set out its ambition to get to net zero by 2050, and also in 2019, the NHS started to take climate change and put it at the heart of what it does. And by doing so, it published within its kind of healthcare strategy in 2019 commitments on climate change, commitments to actually reduce its environmental footprint, commitments around air pollution, commitments around kind of medicines and moving away from kind of high carbon intensive medicines to lower carbon alternatives. And then kind of after about a year, it kind of took a big jump. This Sustainable Development Unit kind of was merged into something we call the Green NHS, which is what I'm part of and where and the team I'm part of. And we launched this in January 2020. Obviously in March 2020 there was a pandemic, but the kind of work still continued. And in October 2020 we published a net zero health strategy. I think it was the world's first at the time. Delighted to say there's many, many more across the globe now. What it did is it looked to kind of see how we could reduce our kind of climate change or mitigation emissions from across the health system. It looked at scope 1, scope 2 and scope 3 emissions, and also kind of every penny or every pound that the NHS spent, and looked to see how it could reduce its emissions. There's a lot, I guess, that we acknowledge that we don't necessarily know yet, and there's a lot more that we can do. However, the ambition was really to kind of signify and kind of make a solid direction of travel, so that the health system that we kind of lead kind of has something to work towards. In 2022, the UK Parliament, as part of its kind of health legislation, decided that it would also introduce kind of net zero and climate change within the health legislation that actually exists. I think it's a world first, but the actual health legislation for our country actually now commits every NHS body in England to kind of consider, take action and have regard for climate change in all of its operations, which was a huge step. We kind of have now the kind of legal backbone of the work that we do now has that kind of to go. Locally, how do we actually make this work? So as part of the Green NHS team, what we have done is we have kind of set out kind of clear guidance for local hospitals, something we called Green Plan guidance. This is our kind of climate change mitigation and adaptation strategies at a local level. They cover a wide range of areas, from energy efficiency, buildings, transport, including kind of both ambulances, but patient, staff, visitor travel, kind of supply chain, procurement, medicines, a whole range of things. And we have kind of asked at a local level, all of our hospitals to have these plans in place. A couple of years ago, 2022, every single hospital in England had one of these plans in place. They're between 3 and 5 years. Some of them are starting to update their plans already, and we're making great progress. But this is effectively how we're able to try and push the agenda and make sure that there's work happening on the ground. In addition to that, at the kind of local health system level, the 42 kind of integrated care systems, we've also asked them to think about how they can contribute to the climate reduction. We know that majority of our kind of emissions and the majority of our risk sits within our kind of secondary care kind of estate and within our kind of secondary care services. However, at the kind of local level, we have tried to make sure that they also incorporate some of the work that sits in there. So bringing together some of the general practices, some of the primary services. Obviously as well, we've also allowing for kind of local systems and local hospitals to have kind of net zero targets that outstrip our own, and I'm delighted to say there's a number that have and are committed to it. And I think the other fundamental thing we have done is try to make sure that all of the hospitals or trusts and also the integrated care boards and systems have someone named and responsible for net zero. It's a very whistle-stop tour, and that's all I had for you, but thank you very much. And thanks again to Austria for hosting the event. Thank you.
Thank you very much, Dr. Patel, for your intervention. Very interesting, and we know that NHS has started leading the way, and that many countries are now following and presenting their own plans and their own activities to become net zero. And we applaud all the efforts from NHS in this endeavor. Now I have the pleasure as well to announce Dr. Marco Aurelio Pereira Horta, who is the General Coordinator on Climate Change and Equity of the Ministry of Health in Brazil. Marco, bem-vindo, and you have the floor.
Hello, thank you very much. It's a pleasure to share with you our experiences here in Brazil, and we want here to discuss the urgent and the vital issue of climate change and its effects on public health. As many of you are aware, Brazil is facing an increasingly severe climate-related events that are directly affecting the health and well-being of our population. And I would like to share these actions and policies we are implementing to mitigate these growing challenges. Recently, our state, Rio Grande do Sul, southern state experienced extreme weather events, including a devastating floods that affected thousands of people and captured international attention due to intensity and impact on local communities. In addition of this acute crisis, Brazil is also facing a prolonged drought that has severely affected water availability across the country. And this drought, combined with widespread wildfires, has significantly impacted our populations. So we're living with these two extreme events, climate events in Brazil today, with droughts and the wildfires. And these events is impacting our populations mainly in Amazon region, and also affect the air quality, exacerbating respiratory illness, mainly in vulnerable populations, including children, elderly, and those with pre-existing health conditions. In response to this crisis we are facing in Brazil, the Ministry of Health is reinforcing our commitment to a multi-sectoral approach, recognizing that addressing climate change and its health impacts requires a robust interinstitutional cooperation. And to this end, the Ministry of Health has established a dedicated coordination unit for climate change and health equity. This unity is tasked with developing and implementing strategies that integrate health considerations into broader climate adaptation and mitigate efforts. This coordination unit facilitated regular, structured dialogues, holding weekly situation room for those climate emergencies we are facing now. And this situation room is composed with representatives from various sectors, including other federal ministries, state governments, and research institutes, with climatologists and health professionals. These meetings, these weekly meetings, aim to foster a steady response and to design integrated and evidence-based solutions to emerging health threats posed by those severe droughts and wildfires. Through this collaborative framework, we seek to enhance our preparedness and response capacity to protect the public health in the face of increasing climate variability. Brazil has a universal and unified health system that provides healthcare, vaccines, medicine, and for more than 200 million people, and is responsible for health service information of diseases in Brazil. And one of the purpose of this unified health system is to reach those distant and vulnerable populations that could not afford for health care. And this is the biggest challenge for our national health system, considering the climate change impacts that is affecting mainly those poor populations and their access to water of quality, pure water. In addition to these efforts, the Ministry of Health is actively involved in the development and the implementation of the National Climate Adaptation Plan, which is being led by our Ministry of Environment And the Ministry of Health is working on the preparedness for the health sector for this national climate adaptation plan. This plan aims to systematically address the health dimensions of climate adaptation by identifying vulnerabilities and prioritizing actions. And also establishing of clear framework for monitoring and evaluation. We are also committed to aligning our national strategies with international best practice, recognizing the need for global solidarity and knowledge exchange in the fight against the climate change. These actions are guided by the understanding that the health sector plays a crucial role in climate resilience. The Ministry of Health is investing in early warning systems, enhancing surveillance and monitoring of climate-sensitive diseases, and promoting research and innovation to understand better and mitigate those health risks. Moreover, the Ministry of Health are prioritizing the health equity, ensuring that our interventions are inclusive and they address the needs for the most vulnerable populations, mainly those populations in Amazonia. We recognize the scale and the complexity of those challenges posed by the climate change. And this Ministry of Health remains steadfast in our commitment to protecting public health. And through continued collaboration, both internal and international, we can build a more resilient and sustainable future for all. Thank you all for the opportunity to share Brazil's initiatives and our approaches to this critical issue, and to share with you the experience with the climate emergencies we are facing now. We look forward to this continued dialogue and cooperation with your partners here. Thank you very much.
Thank you very much, Marco Aurelio. And we pretty much look forward to COP30 in Brazil next year. And we hope that we can, we can continue to count on the leadership from the country and the region of the Americas as well in this landmark of 30 COPs on climate change that started in Rio in 1992, right? This discussion. So I think that this whole topic of climate change and the importance of the connections with health is coming back home, so to speak, to Brazil next year, and we look forward to have this topic highlighted in many sessions, and we count with the country's support on that. So thank you very much for sharing with us everything that Brazil is doing on this regard. Now we cross the Atlantic again, and we go to well, I think to Austria again, but to hear from Germany. Dr. Ute Teichert, the Chief Medical Officer and Director of Public Health from the Federal Ministry of Health, Germany. Please, Dr. Ute, you have the floor. Thank you.
Colleagues in the Americas, Europe, and in Wien, I'm very delighted in behalf of Dr. Ute Teichert to present you a brief insight of our German experience on tackling health care, health system, and the climate change. My name is Tim Paulus. My team and I at the Federal Ministry of Health in Germany working on environmental health issues, climate change, and health. And now let's get started. Climate change is more than just the impact of the change of the climate to our human health, to our own vulnerability. That is what we usually tackle in terms of adaptation plans and adapting to climate change. In our opinion, in our own combined shared opinion, it's also the aspect of mitigation, because the healthcare systems, as mentioned before by my colleague, contributes remarkable to the greenhouse gas emissions. In Germany, it's about 6% of our domestic greenhouse gas emissions. And of course, we have to take into account the institutions mentioned before, like addressing the health sector by public health views, by the view of the healthcare professionals, and of course, as mentioned before, procurement, supply chain, healthcare industry, also having to take into account if we deal with governance in healthcare sector and climate change. Talking about governance, I'm very happy that we do have already an existing WHO framework on governance, as far as I know, highlighting that the governance itself is a real precondition on good health qualities in our population. The key functions of governance I just put on a highlight here, and by experience, I like to focus on some of these governance functions. Briefly, I like to mention in terms of regulation and legislation, we have in Germany right now a new Climate Adaptation Act. And the first time ever, we do have a field of action addressing human health. This is remarkable because our Climate Protection Act is not referring to the health sector itself. So let's have a glimpse look into experiences. If we focus on the governance aspect of policy and vision, I think we have to highlight the initiative of our Ministry of Health in the year 2023 to set up on federal state level a heat health action planning, a combined action of multiple stakeholders. And I'm very happy that we can share a lot of international experiences because we look carefully to what our colleagues did in France on heat health action planning on federal level. So we did highlight some of these points, like putting early warning systems into awareness of our population, focusing on vulnerable groups mentioned before, elderly, and so on. And with this, governance of a high, eloquent political vision, it was able in less than 1 year to establish a real working progress, which is like orientated on public health ideals like Plan, Do, Check, Act. Second experience I'd like to highlight is talking about mitigation, taking into account the stakeholder voice. We are not like organized as the NHS is. We have a multi-stakeholder system with shared responsibility in our German healthcare systems. And what we did is we put up a process with a legally non-binding self-administration cooperation of all relevant healthcare stakeholders in Germany. That is a kind of a multi-layer matrix participation process, and you need a lot of time. And I was very happy to see it on the slide from Austria, to build up the commitment, the trust between all these actors to submit for a common goal. And we are very close to announce our very first health care systems mitigation, climate mitigation plan by the end of the year. So good luck for us on the last miles in this year of 2024. And of course, talking about governance, also about talking institutions, and a glimpse view on the German health system has to take into account that we have levels of shared responsibilities on state level, on regional level, and community level. To give you an idea, we have approximately 400 local health authorities. And this is just addressing the aspect of public health. So what we did is we try to support institutions and put them on the move to engage in change on the institutional level. First, I'd like to announce is our new Public Health Institute, the new Institute for Prevention, which is a perfect fit for the more scientific Public Health Institute, which is known from Germany, the Robert Koch Institute. And we have the first time ever to more establish climate change and health issues on this institute level. We do also work on a new strategic framework, which should be a framework for integration of ideas, measures, and issues of prevention. And one that is tackled is also the issue of climate change and health. And of course, we need to spread the ideas, to spread the function, and to strengthen especially the local level. And as a lesson from the corona pandemic, we spent more than 4 billion euros in the last 5 years to strengthen communal healthcare authorities. If your eyes are not that poor as mine, you probably figure out that digitalization is one aspect of fostering our local health authorities. The climate change and health aspect is not a specific point addressed in this program, but this program will enable us to have a more climate resilient public health authorities and climate resilient thinking public health authorities all over Germany. And last insight, if you look at the planned structure of the new institute, we have, of course, all that recommended units for a public institute, and we can use now, like example given, artificial intelligence concepts and methods and competences, even to adapt on climate change and health issues. That might be a step further. Before I say thank you for your attention, I'd like to highlight at least a few key challenges and questions that we are dealing with in our everyday work at the Ministry of Health. I'm not going to refer to all, but I like to highlight the first one. Our specific problem in Germany, but I also read it from my colleague from the United States, is how to bring your public health priorities on a strategy on a subnational level, so that you can bridge the different levels of responsibilities and shared decision making. And of course, we are always interested in improving the training and education of our healthcare professionals. We have had a good example from Germany, and I'm very happy that we also know that tabletop exercises are also able to integrate health and all policies approaches dealing with climate change, like heat health action on community level. And of course, financing is very important. I always look on the big budget. We don't have any budget. If you put up the heat health action plan in 2023, it was within the existing budget and within the existing regulation. So financing for us is a very interesting issue, and our keyword is try to spend money smarter, putting climate as a indicator on the funding at the Green Fund, the World Bank, whatever, you name it, as of course also on our national level. And of course, last point, let's think about, not the last one, the second last, let's think about bridging monitoring and surveillance. I think we are very, very good in monitoring and surveillance at the moment, and more focusing on forecasting and scenario thinking when we tackle climate change and health. Thank you for your attention.
Thank you very much, Dr. Tim Paulus. Apologies for switching your name. I had a previous version of the agenda. Very interesting insights that you're sharing with us, and I totally agree with the importance of bringing this topic to local levels and not staying on the federal level, especially because many of the healthcare facilities and staff belong to some national levels. So that's the importance of, I think this dialogue is trying to understand all the complexity that we have within the systems and making sure that when devising a plan, that this is also taken into account local level experiences, needs, demands, and capacities to be able to address these issues on the ground, not only at the conceptual level or national level, but also to lower the action to the local levels. Now we cross the Atlantic once more, and I have the pleasure to invite Dr. Lorianne Henry Johnson. She is the Health Disaster Coordinator from the Ministry of Health, Wellness, and Social Transformation and the Environment from Antigua and Barbuda in the Caribbean. So thank you very much, Dr. Lorianne, and you have the floor.
Yes, a pleasant good morning, and thank you very much as well for this opportunity to share in this discussion on health sector governance for climate action. Let me start by saying that Antigua and Barbuda is a twin island nation in the Eastern Caribbean, for those that need that reminder. And we were blessed to participate this year, in the hosting of Small Island Developing States Conference just in May, which really displays some of the governance, indeed, by the leadership of our Prime Minister, the Honorable Gaston Brown, and with the support of all the sectors, but especially our Minister of Health, Wellness, and the Environment, and now also Social Transformation, the Honorable Malwin Joseph. We believe in ensuring that climate action is high on the agenda. So this morning, I'm going to take the approach of looking at impacts of climate change and then actually looking at solutions. So some of the impacts of climate change that we have had in Antigua and Barbuda would definitely include what we faced in 2017 when the Category 5 hurricane Irma devastated Barbuda, leading to total evacuation as other hurricanes such as Jose and then Maria approached. That in itself was an experience for both our populations. Indeed, from that experience, we were able not only to join, as we usually did, with the National Office of Disaster Services, but also create the Health Disaster Management Unit in Antigua and Barbuda, which is the office from which I'm speaking right now. Of course, what I must mention is in that year, 2017, we had actually sought to strengthen our health disaster management program with the assistance of the Pan-American Health Organization. We had also been exposed to training in about May of our architects, engineers. Our then permanent secretary was able to be a part of that training, the SMART hospital training, with others from Antigua and Barbuda to ensure that we could start some initiatives right here in Antigua and Barbuda. We also have had training that would have been done to deal with climate change in terms of mass casualty management training, emergency medical team training. These would have helped us in terms of facing the impacts of climate change. I'm not sure how many are aware of what I mean when I speak about the SMART hospital. So I just took out of the manual just a little idea which will give persons the knowledge of the safe and the green qualities that help to make hospitals and also health facilities SMART. So there's actually a green checklist that we were educated on. And also with that green checklist, we were able later, after Irma, to further get training in Tortola for also our smaller health facilities. So if you would note, the contingency planning for medium as well as our small health facilities was also one of the experiences that helped us. And that is still ongoing. Some other solutions we need to really look at. We have been doing them with the help of our Department of Environment, because remember, the Ministry of Health is also the Ministry of Health, Wellness, and the Environment. So our present permanent secretary, as well as the Minister of Finance, which would be our very own Prime Minister, both share the authority of signing off on projects which help us with climate change. Presently, I want to note also that as Health Disaster Coordination Senior Medical Officer, I have responsibilities also for coordination and communications, as well as liaisoning with the National Office of Disaster Services. A lot of the training that has been given in health disaster coordinator meetings, as well as from the National Office of Disaster Services, who would interact with the United Nations, just to name a few organizations, to ensure that we can meet some of the challenges that we would have with climate change. For example, the heat waves, just to name one. This would assist in disaster risk reduction, which is not only on the level of the Ministry of Health, Wellness, and the Environment, but even we work in the National Office of Disaster Services with other sectors as well. Let me mention also that one of the funding, in addition to the Pan American Health Organization funding that we get, would also be from the Green Climate Fund. Right now, the division or Department of Environment is offering shutters and ACs at a discounted rate to those who are vulnerable, so that with the heat waves, persons can cope a lot better. We also benefit, even within our health centers, from assessments that are done on air quality. Right now, we have a health center that we're not able to utilize. It's in the area of the All Saints region. And because of air quality assessment that's done, we had to move our staff and patients to another location, one of our newer polyclinics. Our health centers and hospital. Smart initiatives have started, but they really need to be advanced. We have tried in terms of the safe hospital policy being approved. We plan to try again and even upgrade to SMART. Our main hospital, the Mount St. John Medical Center, which has been renamed the Sir Lester Bird Medical Center, actually, through SMART assessment, was able to stay safe. However, we hope that the next time we're assessed, we'll actually meet the SMART requirements. We also have recently engaged in reviewing our multi-hazard disaster preparedness plan, which we plan from the Ministry of Health to ensure that it is approved so that the policy mentioned even by my previous speaker will be in place to effect other changes needed to bring about the necessary climate actions. In reviewing our plan this time, we utilized other sectors. We hosted what is called the STAR assessment to ensure that we were able to prioritize our risk and ensure that we had priority intervention plans done. We also are continuing to build our capacity. Just to name a few of the solutions that we are involved in terms of ensuring that there is climate change, that we meet solutions for climate change. Just to name a few of our top challenges: limited financial resources and multitask human resources. However, realizing we need to network, we are appreciative of this opportunity, and we will continue to network nationally, regionally, and internationally. Thank you so much.
Thank you very much for sharing these experiences. Such a vulnerable country as Cuba, especially to the storms and hurricanes, as you outlined the efforts from the country with regards to and how you have managed not only to cope with the existing hurricane, but also to build back better and to capacities to respond to future threats as well associated with climate change. So thank you very much for sharing your experiences with us. Now, I think we have to move on to the next